What is HIV or human immunodeficiency virus?
HIV or human immunodeficiency virus is a virus that attacks the body immune system. If HIV is not treated, it can be lead to AIDS or acquired immunodeficiency syndrome. There's a currently no effective cure. Once people get HIV, they have it for life. But with proper Medicare, HIV had control. People with HIV who get effective HIV treatment can long live healthy lives and protect their partners.
What did HIV came from?
HIV infection in humans came from a type of chimpanzee in Central Africa. The chimpanzee version of virus, called simian immunodeficiency virus or SIV, was probably passed to humans when humans hunted these chimpanzees for meat and came in contact with their infected blood. Studies showed that HIV may have jumped from chimpanzee to human as far back to late 80s. Over decades, HIV slowly spread across Africa and later to the other part of the world. We know that the virus has existed in the United States since at least the mid to late 1970s.
What are the symptoms of HIV?
These are the symptoms of HIV: fever, HIV symptoms and testings, chill, rash, night sweat, muscle ache, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. Some people have flu-like symptoms within 2 to 4 weeks after infection, called acute HIV infection. These symptoms may last for days of several weeks. Possible symptoms include fever, chills, rash, night sweat, muscle aches, sore throats, fatigue, swollen lymph nodes, and mouth ulcer. Some people may not feel sick during acute HIV infection. These symptoms that mean you have HIV. Other illness can cause the same symptoms.
What are the stages of HIV?
Stage 1: Acute HIV infection. People have a large amount of HIV in their blood. They are very contagious. Some people have flu-like symptoms. This is the body's natural response to infection. But some people may not feel sick right away or at all. If you have flu-like symptoms and think you have been exposed to HIV, seek Medicare and ask for a test to diagnose acute infection. Only antigen and antibody tests or nucleic acid tests can diagnose acute infection. Stage 2: Chronic HIV infection. This stage is also called asymptomatic HIV infection or clinically latency. HIV is still active but reproduces at the very low levels. People may not have symptoms or get sick during this phase. Without taking HIV Medicare, this period may last a decade longer but some the progress tester. People can transmit HIV in this phase. Stage 3: Acquired immunodeficiency syndrome, the most severe phase of HIV infection. People with AIDS have such badly damaged immune system that they get an increasing number of severe illness called opportunistic infection. People receive an AIDS diagnostic with their CD4 cell count drops below 200 cells per millimeter, or if they develop certain opportunistic infection. People with AIDS can have a high viral load and be infectious. Without treatment, people with AIDS typically survive about 3 years.
How do I know if I have an HIV?
The only way to know for sure whether you have an HIV is to get tested. Knowing your HIV status help you make healthy decisions to prevent getting or transmitting HIV.